access to quality health care is a fundamental right that everyone deserves. 11 simple words, yet in the United States, 11% of those between the ages of 18 and 65 have no health insurance and therefore limited access to health care. Generally, those under 18 get Medicaid, and those 65 and over have Medicare. Minds greater than mine are trying to solve that on a national level. But let me tell you how we're trying to tackle that issue in my little corner of the world, Martin County, Florida, where 16% of patients in that age group have no health insurance. Our organization has been providing quality health care to low-income, uninsured residents of our county for close to 30 years. I will show you how that benefits our patients, our community, and ourselves. So how did I get here? Let's start at the beginning. I was born in the late 1950s to Jewish parents in New York City. Anybody who knows anything about Jewish culture knows that on that day, my fate was sealed. I was going to be a doctor. Let's skip ahead to May of 1981 when I graduated from Albany Medical College. I spent the next 7 years in the United States Air Force, where I did my residency, became board certified in internal medicine and geriatrics, and most importantly, 41 years ago, I married the love of my life. I completed my military service in June of 1988, and I moved to the Treasure Coast, and I've been here ever since. In March of 2021, after almost 40 years of practicing, I felt it was time to retire. I think that everyone at some point in time comes to a self-realization of the things that they do well and the things that they don't do well. I found out that being retired from medical practice was one of those things that I did not do well. Around that time, the position of medical director of my clinic became open, and after several interviews, I was honored to be offered that job. I can now practice with the sole focus being on the patient, and I can pay it forward by teaching the next generation of doctors. To quote Robert Frost, and that has made all the difference. Show me your hand if you have some sort of health insurance. Okay, I can see that that's almost everyone. For the next few minutes, I'd like you to try and imagine that you didn't. What would you do if you had high blood pressure and you couldn't get to a doctor to get it controlled, or you couldn't afford your medications, and you ended up having a stroke or a heart attack? How about if you're diabetic and you couldn't get your sugars controlled because you didn't have insurance to get to a doctor, or you had to choose between buying your medication or buying your food? How about if you found a lump in your breast, and I'm not just talking to women, and you had nowhere to go to get it diagnosed? Well, I think we all have some idea about what the final outcome can be of breast cancer without treatment. Every day in our clinic, we diagnose and treat patients who, if not diagnosed and not treated, would have dire outcomes. We screen for all forms of cancer based upon current guidelines, and we emphasize wellness visits to our patients. Our patients have had neurosurgery, cardiac surgery, chemotherapy, radiation therapy, joint replacements, all at no cost to them. If they can't afford their medication, we'll try and get it for them. If they can't get to our clinic, we'll send a service to pick them up. If we can't take care of them in our clinic, we'll send them to a specialist who can. And every patient that walks in our door gets treated with dignity, respect, and empathy. Let me give you a couple of examples. For anybody who might remember Dragnet, the stories you're about to hear are true. The names have been changed to protect the innocent. We met Robert in August of 2023. He was self-employed and he worked doing mobile car detailing. He'd been unable to work for several months because of severe degeneration in his hip. When we met him, he was in a wheelchair and he was looking for help. That was far from his only problem. He had uncontrolled high blood pressure, pre-diabetes. He was an alcoholic with liver disease. He had undiagnosed thyroid disease, vitamin D deficiency, multiple nodules on a chest x-ray, and a family history of a ruptured abdominal aortic aneurysm. Honestly, that's fairly typical for our clinic. Patients who've had little or no access to health care come in with one complaint and are found to have multiple other problems. After several months of evaluation and treatment, his blood pressure was controlled, he wasn't drinking, and his liver functions had normalized. He had some dietary counseling and his blood sugar was normal. He'd been put on thyroid medication and vitamin D, and we were now able to send him for a total hip replacement at no cost to him. Two weeks later, he walked into the clinic with a big smile on his face, and he's now able to go back to detailing his cars, and he's able to start to pay back the debts that he incurred when he had no health insurance. We continue to see him in the clinic and help to keep his problems controlled. We met Katerina in May of 2022. At that time, she was 40 years old. She worked cleaning houses, and she had 2 small children. 6 months before that, she found a lump in her breast. Can you imagine that? Going 6 months with a lump in your breast, not knowing whether you have cancer, and not being able to get it evaluated because you don't have health insurance? Well, fortunately, a friend of hers told her about our clinic. Unfortunately, that lump did turn out to be cancerous. She also had a kidney stone that was causing blockage, and she had uncontrolled diabetes. After 2 surgeries, chemotherapy, radiation therapy, dietary counseling, and medication to control her diabetes, I am happy to tell you that her diabetes is controlled, her kidney stone is gone, and she is cancer-free. She is now able to get back to work cleaning houses, but much more importantly, she's able to watch her children grow up. The story doesn't end there. To try and keep her cancer-free and to keep her diabetes controlled, it costs over $1,000 a month in medications, and we are able to get most of those for her for free. I've been practicing medicine in this community for 36 years, and I am really proud to say that the care that our patients get is at least as good as they could get if they had the best medical insurance. Honestly, I could stand up here and tell you stories all day, but sometimes our patients say it best. This is from a letter that was sent to us by a woman who lost her job and therefore her health insurance during the pandemic. I am writing today to express my sincere appreciation for the excellent care afforded to me by your clinic. I have experienced excellent medical care in the past and wasn't confident that a place that offered medical assistance for the economically challenged could provide any care resembling the level of that level of medical proficiency. I witnessed the staff and volunteers at every visit being so professional and sensitive to the needs of all their patients. The professionals at the clinic do not practice the organizational and managerial aspects. They do their work for the love of humankind. Pretty amazing, isn't it? But how do we do it? On a budget of a little bit more than $1 million a year, we are able to provide close to $10 million worth of care. Now, I'm no financial expert, but I know that that's a pretty good return on investment. Our biggest assets are our close relationship with our community hospital, our volunteer physicians, nurses, and clerical staff. We get medications donated from 2 organizations, and our outstanding medical assistants spend hours filling out the paperwork to try and get medications from pharmaceutical company patient assistance programs. We get some funding from our county and from an organization of free and charitable clinics, and of course, we rely on the generosity of our donors. So I hope I've shown you how we benefit our patients. Let me show you how we benefit the community. The large majority of our patients come from working-class families. These are construction workers, roofers, landscapers, the people who wait on you in restaurants, and the people who clean your houses. They don't get health insurance from their employers, and they can't afford it on the open marketplace. They come to us for their care. We keep our workforce healthy. The hospital loves us because we help to control their costs. Hospital costs are the leading cause of healthcare expenditure in the United States. These costs will eventually get passed on to the community. Trying to reduce preventable hospital admissions has therefore become a priority. These are people who may not need to be admitted to the hospital if they got good outpatient care. Well, our patients would have no place else to go but the hospital if they didn't come see us. According to Florida Health Charts, Martin County has a lower rate of preventable hospital admissions than Florida State as a whole. And we like to think that we are at least in part responsible for that. Another concern for hospitals is their 30-day readmission rate. These are patients who need to be readmitted within 30 days of their discharge. This affects hospitals' reimbursements, their costs, and their ratings. Multiple studies have shown that if a patient can be seen within 7 days of discharge from the hospital, their risk of 30-day readmission goes down significantly. But where's a patient without insurance supposed to go? Well, we have committed to our hospital that we will see any patient who meets our eligibility criteria within 7 days of their discharge. We've also agreed to partner with our hospital to see patients who are discharged from their emergency department and don't have any other source of primary care. This has become especially important to the hospital because in Florida, the law now is that a patient discharged from the emergency room needs to be given follow-up care. So I hope I've shown you how we benefit our patients and how we benefit our community. I've talked to you about eligibility requirements, so what are they? Currently, we can see patients who earn less than 250% of the federal poverty level and have no form of health insurance. Currently, that's about $37,000 for an individual and about $78,000 for a family of 4. That may seem like a lot, but try and pay your rent or your mortgage, buy clothing, pay your electric bill, send your children to health care, and still have enough money left over to get any type of meaningful health insurance. I see no reason to expect that a system or a model such as ours could not work for the uninsured in other parts of our country and even in other parts of the world where there's limited access to health care. As I said when I started my talk, I would show you how we benefit our patients, our community, and ourselves. I hope I've convinced you of the first 2 points. Let me address the third and close by sharing with you what we call our culture statement. May we have eyes to see those rendered invisible and excluded, open arms and hearts to reach out and include them, healing hands to touch their lives with love, and in the process, heal ourselves.